Now, remember, it's not all women that get infected with this human papillomavirus that eventually end up developing the cancer. Some women will get it, will pick up the virus from a man, but because they have a competent immune system, immune system, the man call it the soldiers of the body.
It will die
that fights any foreign thing, any foreign organism, any microorganism that is not accepted by the body. The white blood cells will fight and destroy it. So for some of those women that have good immune system, once the virus is in the mouth of the womb, the antibodies will recognize it, and they will destroy that part of the mouth of the mouth of the womb, and the woman will free from it. But however, for those women that have poor immune system, something reduces your competence of your immune system, they are predisposed to that. They are at higher risk than those women that have competent immune system, right? And that is why the APIN, the non-governmental organization, decided to take it up. We know that there are a lot of women that are living with HIV. We all know about HIV. HIV has been driven down to a point where people are living with it without any problem. But those women that are infected with HIV are at higher risk of developing this cancer than women that are not infected with the HIV. And that is why the organization took it upon itself that we must ensure that all women living with HIV should avail themselves for the opportunity to do the cervical cancer screening. And that is the only thing the organization has to give back to our mothers, our sisters, and our daughters. If you love them so much, truly we need to go extra mile. These things are happening. Now, if you see, say, out of 100 women that just passed through, about 10% of them are having precancerous lesions. It's not yet cancer. But if nothing is done after so many years, they will come down with full blood cancer. Because many people have not seen women living that have cervical cancer, the kind of pains they go through before they die. It affects the entire family, both your resources, your time. And it's also you're also going to push more pressure even on the health system. But the beauty of this is that it is curable at a precancerous lesion stage.
That is when if it is detected in time.
Yes. So it is not for the women, for the men to tell the women, go and screen. I heard something about this cancer, to go and screen. Encourage them.
If there's need, you can actually take her there yourself.
Yes. Encourage your wife, encourage your daughters, encourage your sisters. Because we say, somebody will ask, okay, who are the people that are supposed to go and
do we have any age range?
Yes, we have.
Those who need to actually,
now,
for the females.
For women living with HIV, we said for 15 years, they should go and avail themselves. Because we know that the cancer starts earlier in them because of that immunosuppression. We encourage them to start earlier. Then for those that are HIV negative and all, they can start 20, 25. But we want that screening to be done. For here, in the Plateau, we're advocating that we want the women to screen yearly. Because we want to actually get more of them. If you do it yearly, you are able to get more of the people screened than to say, okay, let's screen once in 2 years. Some will slip off. But as we're encouraging them to screen once a year. Every year, come and screen. You come today, we check, we say, have you done the screening? You say, yes. Oh, it's okay. You are okay, you are negative. Till next year. And what APIN has brought to the state is that this screening is free. It's free of charge. So for something that is free, that will keep you alive once a year,
is it everywhere or a particular location or hospital?
Okay, so the APIN Public Health Initiative, it's currently in 5 states.
Before you delve into that, I'm sorry, what is APIN?
Okay, so APIN is a non-governmental organization, and we are actually the leading non-governmental organization, and what we actually our focus is actually on HIV and other diseases of importance in Nigeria and in Africa. And we go with a lot of approaches, what we call cutting-edge approaches that are sustainable. And cervical cancer is one of those diseases of importance in Nigeria, and we as an organization have decided to actually, to really make sure that we get it across. Because the truth is, in all that my colleague have said, awareness is actually very important. So for every year, just like any other disease of importance, we actually commemorate cervical cancer awareness we call it Cervical Cancer Awareness Month because it's done every January of every year. And for us, across the states, we actually program, including PLATEAU State. We make sure that we actually commemorate this with the states. And so basically, for this year, we are looking at making sure that people get to learn what cervical cancer is all about, and that's why we're here. We are looking at educating people through awareness creation. They need to know, they need to make informed decisions, and then screening. And in the screening, you have the primary and the secondary. For us as an organization, our focus is on the secondary. And maybe I should give you an idea of what the screening is all about, because there are different forms of screening. And like my colleague, who is a senior colleague in the obstetric and gynecologist, there are different forms of screening. But for us as an organization, we are, like I said, we are looking at sustainable approaches. And one of the sustainable approaches, which is actually adopted by the Nigeria Federal Ministry of Health, is screening using visual inspection with acetic acid or lugosiodine. And this we do it across, in PLATEAU, we program in 29 ART sites, which we call comprehensive ART sites. We also are in PACs, primary health care centers. But when the comprehensive ART sites, where we actually implement this cervical cancer program, we are in 29 facilities. But currently, because we are funded by CDC, we are in 24 out of these 29 facilities. And like as I speak to you, these sites we have set up cervical cancer units there. We have equipped those sites, right? And we also support them with consumables, which they use for the screening. We've also trained over close to 100 healthcare workers, both doctors and nurses, in terms of screening. So that is to show you it's actually adding to what my colleague Dr. John have said, because if this is a preventable illness that if you do the needful, you won't have to get to the point of the cervical cancer. But as I speak to you, Nigeria is actually the third when it comes to cervical cancer. Looking at the cancers in Nigeria, cervical cancer is actually, Nigeria is the third, that have this burden of cervical cancer. Yeah, and when it comes to the death rate, Nigeria is actually the second place. So it means that we actually have a whole lot to do. Yeah. And if it is preventable, we can actually cut this thing down to the barest minimum. So for now, we are focused on the secondary screening, and like I said, our focus is on PLHIVs, who are 6 times more at risk of having this cervical cancer than the people living with HIV. So our focus as an organization is to get these people that are more at risk to screen, get it at precancerous stage, and even treat it. Currently, all these sites, the 24 sites, we also have what we call thermal ablation machine, which can be used to provide that treatment and even get to the point of to stop the progression of this getting to this cancerous stage. So that is a bit of what we do.
All right, our viewers and listeners, for you to actually join in the conversation, you can go to our Facebook page at Unity Radio FM TV. Just like our page and drop your comments, and we'll take your comments directly on the program. Or you can better still send your SMS and the number 0803-749-7127, or the numbers on your screen. But if you actually listen us from the radio, 0803-749-7127. Go to our YouTube page at Unity TV, and we have our specialist doctors in the house, and send in your questions and you get an answer. All right, you said cervical cancer, okay, month, that's the awareness month. Yes. Is every January. Do you have any specific date or?
So it actually runs throughout the month. So people, different people pick a week. Like for us as an organization on the Plateau, we are picking this week as our cervical cancer awareness creation week. But some others have done theirs within the, but globally, the cervical cancer week in the month of January is between the 22nd and the 28th of January. That's when it's actually commemorated. Okay. But in the month of January is actually about cervical cancer.
Okay. Do you have any symptoms?
Yes. One will wonder, is there any sign or a symptom that the woman will show for us to say, yes, she's most likely going to have this problem? Now, for the precancerous lesion, which is the findings before it becomes full-blown invasive cancer, there is no any symptom. There is nothing. The woman will not have any complaint. She's living her normal life without any complaint.
She will also conceive and give birth to children.
And give birth to children. That will not hinder her. But when you will not begin to have the symptoms of cancer, that cancer has gone far. And that is why it's really, really bad. By the time you begin to pick it up, it's an advanced cancer. What are some of the symptoms you find? Woman begin to bleed from her private. Or
even though she is of old age.
Even if it's old age. Let's say she has entered menopause and suddenly she wakes up, she notices that she's bleeding. That is a possibility that she may be having cervical cancer. Or after having a sexual relation with her partner and suddenly bleeding will follow. That is also a sign that something is happening at the mouth of the womb, and most likely that will be cervical cancer. And then if you begin to have a foul-smelling vaginal discharge, that even when somebody is close to you, the person can easily perceive such an offensive odor. That means something is really going on. Most likely that will be cervical cancer. Sometimes the women will tell you, maybe while they are trying to clean up, they feel a mass within their vagina. That means most likely you are dealing with cervical cancer. So those are some of the findings you will get. And at this stage, we don't want the women to get to this stage. At this stage, we are dealing with an invasive cancer. Most of the time it's advanced. And that is why we still emphasize the screening.
Okay.
It's very, very important.
And in most hospitals, if you actually go to register for ANC, you undergo various tests.
Yes.
You know, we have those of HIV, you know, you also get to go for scan, this and that. Why is it that we need to advocate that also the cervical cancer screening should be added to that? I think with that, we, you know, get a lot of women actually delving into that to actually go for the screening and know your status.
Yes, that is also advocated. Some facility advocate that pregnant women should undergo cervical cancer screening. However, during pregnancy time, because of the hormonal changes, the findings you are going to get on the mouth of the womb may not really be in keeping because of the hormonal changes on the cervix. So even if a pregnant woman comes in, we screen and we say, well, there is a features in keeping with precancerous lesion, we may not act. We have to allow her to deliver the baby and go through 6 weeks we call preparing, for which back then everything has gone back to the pre-pregnancy state, and that is when it will give us a true picture of that very cervix. And that is why we don't bother to stress them about that. And then we're also being careful because of our attitude of our people. Imagine a pregnant woman, maybe in first trimester or second trimester, come for cervical cancer screening, and you do the screening for her, and subsequently she now has spontaneous miscarriage. You know the way our people do? They will rope it on the cervical cancer screening. And they say, after I went for cervical cancer screening, that's when I had that miscarriage. And before they will get back to you, for you to really explain the concept of spontaneous miscarriage, they have gone round everywhere spreading the bad news. And by so doing, they will discourage other women from coming. And then knowing that if a woman has precancerous lesion, we are not expecting that within 1 month or 2 months or the next 6 months you come down with the cancer, unless maybe you already have a carcinoma in situ. And that is why we say, in order not to stress them and also bring this controversy within the antenatal setting, we can allow them deliver, go through the 6 weeks after delivery, and then come back for the cervical cancer screening. So we advocate that just not to bring that bias and then give it a bad name, whereas there's nothing wrong. But if not, that for those that are well enlightened, that have their health behavior is good, and they understand, we can do the cervical cancer screening during pregnancy. Okay,
what can we say? What is the role of men in actually preventing these? You know, all these they are pim, sharing, issue of cervical cancer.
First, I want to say that you can see it's just men that are here, just to show, because we are in a patriarchal society where the men actually have a whole lot of say in when it comes to women care. So for us here, the advocacy is we should give, like my colleague said, our women, our children, the opportunity to go and screen. We can even remind them, because sometimes it's just like prostate cancer. I'll share this. My sisters are the ones that remind me, you have to get your prostate cancer check, your PSA, your prostate specific antigen test. So that way, we are also saying the men should remind their wives, okay, it's 1 year ago you did this screening, go and do it again. What's the result? What do we do from there? And the truth is, from our experience from the program, because this cervical cancer program for 18 public health initiatives on the Plateau started as far back as 2019. Like I said, there are other screening methods that are already happening across our facilities through the obstetrics and gynecologist department in the teaching hospital setting. But for APIN, using the visual inspection with acetic acid and glucose iodine screening, we started as on the Plateau in 2019 in 2 facilities, and we've grown to 24 facilities. So the point is that from the program, we found out that actually the men, we have a couple of men that are actually supportive of their wives, making sure that they go for this screening. When they are pregnant, they wait for that 6 weeks, and they tell them based on the health talks that we do across the facilities that we implement. So we need more men involvement, to get our women to screen. Like I said, we are still far away from where is expected, in terms of the global burden, or in terms of the burden of cervical cancer in the country. So we need to really reduce it. It's a preventable illness. It's something that can be prevented, but sometimes we get health-seeking behavior is what is affected. The truth is that the women actually have more health-seeking behavior than the men, but because of the society and the culture involved, we need the men to actually promote it, to actually advocate, be the to push for it and help our women to actually get to screen.
All right. So, how can a man actually? Do we say abstinence is the absolute, answer for men to actually prevent, the spread of cervical cancer?
Well, thank you for that question. I know most of the time when we do this talk, most of the women will always in unison. They always rise up and say, there must be something for the men. People are always advocating it. We women all the time, we are the one carrying all this burden. What's up for the men? And I usually tell them, well, you see, abstinence is something that's very difficult. We can talk about it, but truly, in a real sense, how many people abstain? And remember, this is a social thing. You don't go and impinge on people's social life. You allow them be. And that is why for the men, there is nothing much we have to pin down on the men for now. In terms of maybe screening or one form of treatment or the other. I know some women also ask, okay, can't we advocate that our men should go and do human papillomavirus testing? Let us all know whether they are already infected with the virus. Yeah, that would have been another way of looking at it. But remember, these are all social things. These things are sexually transmitted. You don't go meddle into people's social life that way. Now, besides, the human papillomavirus testing is really, really expensive to do it for an individual.
Okay.
It's over 100,000. And how many of the men
will actually give out 100,000 just to,
and then the question is that if we test you positive, what do we do for you? There's not much we do for you. The virus is already there.
Okay, if the virus is already there, there is no much help.
Well, we don't have any drug now to say that this drug is targeted to human papillomavirus alone. And remember, these human papillomavirus, they come in different serotypes. A different serotype. Which one will you analyze? The one that causes the cancer is a high-risk human papillomavirus serotype. Mostly serotype 16 and 18.
Okay.
Those are the two major ones. Almost about 70 to 80% of the cases, they are the ones that have been implicated. So we won't go and say, okay, fine, let's find a specific drug for that serotype and start treating the men. And coupled with the fact that this virus doesn't really affect the men. So the women that this virus affects, they concentrate on them. Knowing that, fine, there is some signatures of the virus on the mouth of the womb that we can pick before it becomes a full-blown cancer. And when we pick it, we can deal with it and treat it, and the woman will be free from it. So for the fact that we don't have much to do for the men, we advocate that let the men also encourage the women. Sometimes some of the women will say, no, okay, why not the use of condom and all that? Yes, being that it's a sexually transmitted, the use of condom can, to some extent, reduce the spread of human papilloma virus. But funny enough for the virus, we also have the virus can be transmitted through contact, what we call the labioscrotal contact. And sometimes some people jokingly will say, but the men don't wear condom on the scrotum. And that they can also transmit the virus from the scrotum to the labia. So, and that will not be another social issue. They begin to point on it and begin to affect people's life in the way they don't want it. So we said, no, we can't deal with the men on this. Now, since we know how to find this virus, the effect of this virus on the women before it becomes full-blown cancer, let's deal with the women. And that is why we are emphasizing on the women for the screening and emphasizing on the men to encourage their wives, their daughters, and their sisters to come for the screening. Now, somebody will ask, what are the risk factors? What are the things that make women to come down with this cancer? Like we said earlier, immunosuppression. Being HIV positive on its own is a very big risk factor. The other one again, remember, is sexually transmitted. When a woman has multiple sexual consorts, definitely. When you have multiple sexual partners, most likely you may end up having sexual relation with a man that is infected with the human papillomavirus. So your risk is higher. Now, for women that have given birth multiple times, now remember, each time the woman gives birth, there is a tear and wear on the mouth of the womb. That tear and wear requires repair. And then, if the woman already has been infected with the human papillomavirus, that process of repair, that new cells will grow back to repair the part of the womb that has been torn or that has been stressed. That process, the virus in it may not allow the smooth repair. Instead of new cells to grow, those cells will grow into an aberrant cells that continue to multiply uncontrollable. And that's what we call cancer. Because cancer is cells multiplying on their own uncontrollably, leaving their original place and spreading to other places. So for such women that have given birth multiple times, yes, it's a risk factor too. And of course, for women that smoke too. Nicotine being a substance that can also predispose to cancer. So I will find that the nicotine is secreted in the cervix. So imagine you having the virus in the cervix, which predisposes to cancer, and you are now smoking. You are now secreting nicotine. So you're having two factors that can cause cancer. So it can easily metamorphose into a full-blown cancer in those women.
Okay, what are the symptoms of precancerous lesions?
Well, does not have any symptom. That's the sad thing about it. A woman with precancerous lesion will move around all her days, having children, nothing, no discharge, nothing. Nothing that will prompt you to go to hospital. The only time you see something that will prompt you to go to hospital
is when it has grown.
Become an invasive cancer.
Wow.
And it's very, very scary.
This is serious.
Let me just add here. It calls for discipline. It calls for something. It's just like we deal. Let me use a simple example. None of us can live without eating.
Yeah.
Right? So it means if you make it a point of duty that you have to screen, right? It just becomes part of your routine. You've screened, you get the results negative, and then you know the risk factors and you try to manage it. That's all that's the advocacy. What you know, you can prevent. But what you don't know, and you don't have an idea of what the risk factor is all about,
and you cannot actually see it because
you
it's
just
within.
keep making the same mistakes all the time. So, like my colleague said, we are not impinging on the social aspect of life, as we are not saying don't abstain, but we are saying you can actually screen to know when it's precancerous and there's a treatment for it, and that's where the Open Public Health Initiative comes in. Our role in the cervical cancer program is to make people know that you can actually screen, right? For the HIV positive clients in our society, they can screen across the facilities that we are supporting for free. But for the negative ones, the truth is that, okay, for the negative ones, the truth is the cost of this screening is actually far, it's what it's, because sometimes cost becomes a problem why people don't screen. But the truth is that when you check the cost of the screening and the cost when it grows into a full-blown cervical cancer, it's both, you can't put both side by side. Because the cost when it's already full-blown cervical cancer, the treatments can go as far as even hysterectomy or being on chemotherapy for some time, and it's like you're buying time for the end. But what we are saying is screen. Screening is the best way to know what to do. Once you get the precancerous lesion, it can be treated because it's around that mouth of the womb. It can be treated with just a simple thermal ablation, and you are fine. You are checked again, and you're fine, and you move on with your life. Because, and I like to emphasize that the women deserve, after you've gone, like the analogy my colleague gave, you've gone through your whole life training your children, and the time when you are around relaxing and saying, my children are going to look after me, this comes up. So it's very important that we are aware, like the theme of this Cervical Cancer Awareness Month is learn, educate, and screen. So learning is continuous. We need to keep learning. We need to keep understanding how this works. And we need to be educated that even in our environment, in our state, there are places you can walk in and you get screened. It doesn't take time. You get screened, you know your status, and you know the next line of action, and you are fine, and you move on with your life. So it's very important that we actually take it serious. And the truth is, looking at all the cancers we have from breast cancer in women, this is one cancer that if we really apply that discipline, just like we apply in our religion, we can actually bring it down. And
to the barest minimum.
Yes, the burden in the country will drop.
Okay. You keep mentioning of centers where one can actually go to and screen. But can we have some of the names?
Okay,
Let's
so
know where we can actually head to while going for the screening.
So we actually collaborate with the State Ministry of Health and other partners in the state, stakeholders like PLACA, like State Hospital Management Board, and currently sites like JUT, Just University Teaching Hospital, right? We're in Bingham University Teaching Hospital. We're in Ola, Jos. These are sites in Jos.
That within,
yes,
close by, yeah.
As far as Shendam, General Hospital Shendam, even as far as St. Vigius Hospital.
So you've gone to the
actually,
remote areas also to actually.
Just to give you an idea, we have 17 local governments in the state, but we are in 15 local governments currently, and the sites, these 24 sites where we are in these 15 local governments. So you could imagine knowing that the facility where you can actually do your screening is just far away. It's not just far, and because most times the mindset of people is everything is in JUT, but we have facilities as close as in our community, in our LGAs, that we can actually go and screen and get treated at the same time if it's precancerous lesion.
Okay.
Let me say this. Most of the time, women will always ask that question and say, we are infected with this virus by the men. And if we don't address it, you find out that the women go home and start attacking their husband. I went for screening and I was said that I have precancerous lesion and there is a virus and that virus is sexually transmitted.
It was given to me by me.
But are you making trouble? And we usually take our time to tell them, no. You may not be infected by your index partner. It may not be this current partner that gave you this very virus. This virus would have been picked back then in primary school, secondary, or even in the university, before you even got married to that man. It may not be your index partner that infected you with the human papillomavirus that has predisposed you to this cancer. So that women don't go fighting their index partners and begin to, I've seen it happen. To go back home is real trouble. Say you are the one. I've been suspecting you. I know it. Now you have finished me and all that. No, it's not your index husband that may be responsible for that virus. He may not be. So, and we are not here to search who is responsible for bringing the virus.
It cannot even be traced.
It cannot be traced.
Yes. All right, for you to actually call in and share one or two on the conversation, you can call us on the number 070-3235-3315, 070-3235-3315, or the numbers on your screen. All right, we have a text message that says, "Hello, HAJARKU and San Ibrahim. This program, they need to advocate tests before marriage. It is very important." It's coming from Shafiu Alhaji Musa Tilara Fingura in Toro local government, that's under Bauchi State. All right, thank you so much. And we have on our Facebook page, we have Alfred Sterling. He says, "Nice one." All right, Alfred doesn't have any question to ask. The number for you to call again is 070-3235-3315, and we have Bamshak Victor saying, "Watching you live from Onitsha." All right, thank you so much, Bamshak Victor. Our Meglas, good morning, Unity FM, watching you live from Abuja Market Jos. All right, no questions for the doctors in the house. The number for you to still call again is 070-3235-3315. Just like the doctor have said, your immediate your index partner might not be actually the person who gave the cancer to you, and the doctors themselves cannot actually trace who actually. So what's the even essence of knowing who actually gave it to you? The important question is how to get treated of that particular, how to get screened. And you also heard from the doctors themselves. There are centers close to you. We have the Jos University Teaching Hospital, we have the Bengam and the Ola, which is just a stone throw away from residents of Jos North. You can actually go there and get screened, because when it's been detected early, it's more easier for you to actually get treated than for you to actually wait for it to outgrow, and there's nothing the doctors can do. Just some one or two that will just buy you some time on earth, which is very, very sad after undergoing a lot of stress throughout life, and it's time for you to actually sit down and eat the fruits of your labor. Then a disease comes and it will be very, very sad. And do not forget that this January is the cancer month. So the last words to have?
Yes, one of the messages you got, somebody said, is there a place for us to have this test prior to marriage?
Yeah, it's very
Now remember, we said the testing for human papillomavirus as an individual is expensive. Unless if the family wants to go through it and say, okay, fine, let me do human papillomavirus testing on myself, let me do human papillomavirus testing for my wife. Now remember, there are several serotypes, but the most risky ones, the high risk ones, are the serotype 16 and 18. If you screen for the serotype 16 and 18, maybe serotype 33 may come knocking. Then will you go through spending millions of naira checking for those things before you now get married? You do it for yourself and do it for your wife. That would be really, really big, to be a serious thing to do before you get married, with all the expenses that will go with that very marriage. Now, we advocate that there is no point. There is no point of wasting that money. As long as the woman will avail herself the opportunity to be screening regularly, they should just save that money. It's not that, if you are screening yourself regularly, it's not that scary. We can always pick it earlier and then deal with it. Save your money. Use the money to prepare for other things that has to do with the wedding, than to spend so much money screening for human papilloma virus. Now, well, the only place where the need for screening may be, unless for those that said, okay, in order primary prevention, there is a place for vaccine. Though now the government is trying to, it has been launched, very soon it will be disseminated, that the vaccine to prevent this virus will be disseminated all over. But remember, for now, the government is only emphasizing on preschool boys and girls. We're looking at those that are between 9 to 14 years. And then now the government is looking at the girls. But in the whole package for the vaccination to prevent this, you have to vaccinate the boy, and you have to also vaccinate the girl. Now, if you vaccinate the boy, and these things are done at peak, those 9 to 14 years, with the assumption that they have not had sexual debuts. Because we know that it's through sex you pick up the virus. So before they have their first sexual intercourse, you can get them vaccinated. And then subsequently, they can be free. from it. If tomorrow they don't have sex and they pick up the virus, already have their built immune system, immunity against the virus. But these are the things that the government is on its way. They are still trying, although it has been launched.
We hope that
very soon we will all, but for now the emphasis on the girls. Okay. And we know that over time the government will also emphasize on the boys too.
All right, thank you so much, Dr. John Onyeji. All right, Dr.
So just to add, like I said, APN Public Health Initiative, we are in PLATEAU, and we have 24 sites. I don't know if I should list the sites. We are in Ola, Jos, PSS, Plateau State Specialist Hospital, Bingham University Hospital, Barrack and Ladi, General Hospital Barrack and Ladi, Cooking Rehabilitation Center in Mangu, General Hospital Panshin, Dengi, General Hospital, Tunkus, General Hospital, Lantan, General Hospital, even Zamko in Lantan, and then we have St. Vigilus, Cooking Rehab, Cottage Hospital, Kuala, Vom Christian Hospital, Bokos, Cottage Hospital, Fit Alive, Jute, and General Hospital Mangu, General Hospital Shendam, Cottage Hospital Bassa, General Hospital Angwari, Hoshe Medical Center, SDA Jingri, Olazawan with us, and Ekwa Bukuru, which is actually sent, I think they've changed the name to, I can't remember the new name now, but Ekwa Bukuru. So the point is that these screening centers are for screening and for treatment of precancerous lesions. So please, let's our women and let our men support them to screen. And I think we'll be fine with that.
All right, you heard from the doctors themselves. All right, the numbers on your screen. For more information, you can also call the number 08037497127. Let's know your location and where you can actually get your screening, and it's free. Please encourage your women out there. The men should encourage the women, your daughters, your sisters, your in-laws self should actually go there and have their screening for free. A very big thank you to you.
Screening for free is actually for the people living with HIV.
Okay, for those with HIV, the screening.
But please, we are also
free.
saying that the women, even if you have done your HIV status and you're negative, please still go and screen. There are screening happening across all these sites.
Okay.
And you can also, although you may have to pay out of pocket, but at least.
All right. This is where we'll round up the cutting of the program. A very big thank you to you all out there who find out time to view us on our Facebook and YouTube, and also send us text message. Without you out there, I wouldn't be sitting here and there also, because the information is for you. Keep a date with us on Thursday, same time, same station. Bye.